Choosing how to replace missing teeth can be really overwhelming. So let's clearly break down the differences so you know what's best for you. Starting with option number 1. Dentures. Dentures are removable prosthetic teeth that are usually made from acrylic and sit right on top of the gums. On the upper denture, the appliance usually covers the entire roof of the mouth so it can create suction. What this means is that it's usually blocking the part of your mouth where taste comes from. On the lower denture, there's no suction at all. As it's resting on your lower gums, it's easy for the lower denture to slip and even fall out, which makes lower dentures the most difficult to stay stable. With traditional dentures, patients can only generate about 10 to 30% of their biting force. What this means is that it can be extremely difficult to eat things like nuts, apples, and even a steak. The main advantage of dentures is that they're usually the most affordable up front, and they don't require surgery. The trade-off is stability, chewing power, and taste. Also, since there's no implants in the bone, there's nothing stimulating the bone. That means that bone loss can still occur. For some patients, especially when health or budget is the main concern, dentures can still be the right option. They're just rarely the best long-term option. Option number 2 is a dental bridge. Bridges are typically used when someone is replacing one or a few missing teeth, not a full arch. The bridge is anchored to the natural teeth on either side of the missing space. Those teeth have to be trimmed down to support the bridge. Unlike a denture, a bridge is not coming out, and sometimes a bridge can look good. The limitation with bridges is that the missing space has no root or implant, and what this means is that the bone is not being stimulated. That means that bone loss can still occur. But with an implant, the bone is actually being stimulated. What this means is that bone loss is less likely to occur. And if one part of the bridge fails, the entire bridge needs to be replaced. So bridges can work in the right situation, but they're not designed to replace a full smile. Option number 3 is an implant retained denture, often called an overdenture. This looks very similar to a traditional denture, but now we've placed implants into the jawbone. With these dentures, they snap right onto these implants, which provide for a more stable design. With this option, most patients have about 50 to 65% of their biting force, which is a big improvement from traditional dentures. Since there are implants in place, they can help slow down bone loss in the areas that they're placed. That being said, this is a removable prosthetic, so you have to take it out to clean it. Also, the snap-in components tend to wear down over time, needing maintenance and sometimes even replacing. On the upper arch, they tend to still have phalanges and cover part of the upper palate, depending on the design. These can be a good middle ground option for patients who want more stability and something that's still removable. If this video is helping you so far, drop a like and consider subscribing to the channel. It'll help a ton so that we can reach more people like you so they can make confident decisions about their dental health. Option number 4 is fixed dental implants, also known as all-on-4 or all-on-X. A full bridge of teeth is securely attached to multiple implants that are placed in the jawbone. Since the bridge is attached to multiple implants, the forces are evenly spread across all the implants. However, this option is not removable by the patient. These teeth are designed to function just like natural teeth. Most patients can eat, speak, and smile confidently again. These materials can vary from acrylic to ceramic to zirconia. These can affect durability and long-term performance. Just as materials can vary for offices, so can timelines for treatment. It's very important to understand that at many offices, the teeth that you get on surgery day are just temporary teeth. It can sometimes take months and multiple appointments to get your final teeth. It's very important to ask what kind of teeth you're getting and when, because teeth in a day can mean very different things. At Nuvia, our approach is a little bit different. Our goal is to deliver permanent teeth just 24 hours after implant surgery. These are not temporaries. These are your permanent teeth. After implants are placed, we digitally scan your mouth and we start making your smile. Our in-house lab works tirelessly overnight to start milling your teeth. That means you don't have to wait months on end and have extra appointments to get your permanent and final smile. This option isn't always right for everyone, which is why proper evaluation is always the first step. So, what does all of this cost? The reality is, it varies between each option. Some options are cheaper up front, but they require more maintenance over time. Others are meant to be long-term solutions. If you're looking into dental implants and want a clear understanding on how cost is decided, we've put together a free dental implant cost guide that breaks this down clearly. And you can download that using the link below this video. Choosing between dentures, bridges, and dental implants all comes down to a few factors: your lifestyle, overall oral health, budget, and long-term goals. There's no one-size-fits-all solution, just what's right for you. We strongly recommend stepping back and looking at how many teeth are actually missing and what you hope to achieve by getting new teeth. For example, replacing 1 or 2 missing teeth is a very different solution than replacing an entire arch. The solution that works well for a small gap may not give you the stability, comfort, or confidence you're looking for when missing multiple teeth. It's very important to ask yourself, what truly matters to you? Whether that's being able to eat certain foods again, speak clearly again, not have to worry about something moving in your mouth, or to have something that truly feels permanent to you. When those goals are clear, it becomes much easier to determine which option makes sense to you and which ones fall short over time. If you're curious whether permanent teeth in 24 hours is an option for you, we've made it easy. You can take our quick eligibility quiz in the link in the description and continue learning at your own pace. Thanks for watching.